of the colourful clothes she wears.
Health and well-being is important for all of us, especially for our patients. And a part of that is looking after people's nutrition and their hydration. We wouldn't expect a plant to thrive if we didn't give it adequate water. Sometimes when our patients come into hospital, or indeed come in contact with our community teams, they are at their most vulnerable and they're unable to support this on their own. We need to take that responsibility for them, ensure that they are adequately hydrated and can move towards a more healthy and well-being lifestyle. But don't forget to record this information. It's really important that we know exactly how our patients are doing.
So what is dehydration?
Dehydration means there isn't enough fluid in your body, so if you're not drinking plenty, you might get dehydrated.
So why is that important for our patients?
It has a significant impact. If you're dehydrated, so hydration is very important. It prevents constipation. It's useful if somebody has diarrhea or loose stools. It prevents blood clots, pressure sores, bed sores, urinary tract infections, maintains good blood pressure, and prevents falls, which can be caused by dizziness or confusion.
So what are the signs and symptoms of dehydration?
You might notice the patient's got dry mouth, dry skin generally. They may be suffering with constipation. You could ask them what colour their urine is, as this might have gone dark, which is a key sign that someone's dehydrated. They might be very thirsty.
Confusion, constipation, are they drinking or eating less? Are they prone to infections?
You could also check the patient's skin to see if the elasticity has reduced.
Okay. Yeah.
So we're going to look at the cup quiz. And you're going to guess how much is in your cup. So these may be some of the cups you see on your wards. So I'd like you to guess how much is in each cup. So what's your guesses for cup 1? It's 200 ml.
200.
250.
100. 275.
I'm going to go 350.
So well done to 200.
500. 400. 300. 325.
I'm going to go 300 as well.
And the answer is 350. The last cup to guess.
I think 250.
300.
325. 300.
280.
It's 300, so well done.
So this is ideally how much we should be having a day, which is 2,000 millilitres, which roughly equates to 6 to 8 glasses of one of these size cups.
So would you be able to tell me, in addition to drinking fluids like water, what else can we have to hydrate ourselves?
Things like fruit juices, milkshakes, teas, coffees, squash, soups, and fruit and veg, such as watermelon, salads, and even yoghurt and jelly will help keep you hydrated.
Very good, thank you.
Now, I was admitted to a ward here because I wasn't feeling very well, and I mentioned to the doctors that I had a history of UTIs. However, nothing was done about it, so obviously I wasn't drinking enough, and that led to an infection that I had to go to an acute hospital for to get treatment. So I was on IV fluids and antibiotics, and then subsequent to that I was sent back to the ward, where again I ended up with another UTI because the staff were busy and I was feeling pretty rubbish, so I wasn't drinking enough. So obviously I was susceptible to another infection, and which again I needed treatment for, so it wasn't a great experience really.
So this is Jane's fluid chart. As you can see, it's been poorly completed. There isn't a sticker, there isn't a date, there isn't any totals at the end, and it's hard to see how much fluid she's actually had.
So now we're going to explore the experience that Jane should have had.
I was admitted to a ward recently feeling particularly rubbish, and I had a UTI, and I explained that to the doctors. And from the outset, my input and my output was monitored, people were offering me drinks because I felt quite rubbish, and so I wasn't able to go to the kitchen to get myself a drink. So the staff were constantly encouraging that, completing a fluid chart to keep a track of what I was drinking, because I wasn't able to do that for myself. And as a result of that, I believe that I felt a lot better. I ended up being treated with antibiotics, and I felt that my physical health was taken just as seriously as my mental health. And as a result of that, I felt a lot better and well supported by the staff.
So here we have a better completed fluid chart for Jane. You can see it has a patient label, consultant name, fluid target intakes, her likes, dislikes. It's completely filled in, and we can see her totals at the end and her output and input. It's mine.
It's mine.
It's mine.
It's mine.
It's mine.
It's mine.
Is mine.
It's mine.
It's mine.
It's mine, but it's also yours.